being call this taught to you. I know the principal, the professors already taught you where and when.
If you were not gonna after
Yeah.
Nabibitin ako eh, nabibitin. Very good, okay yan, okay yan. Saan tayo? Mukhang magandang example.
Yung pinakamahirap daw po.
Nasa Alcor Beach ka. Alcor Beach. Alcor Beach. Sarap mag-beach, di ba? Alcor. Ngayon may nakita kang nakahandusay. Okay? Everything is normal sa paligid. Wala kang makitang umaapoy, sumasabog, wala. Lahat maayos eh. Wala kang nakaamoy na kakaiba. Maliban sa mga Indiano. Okay? Everything is normal. Okay? Everything is normal.
It's not normal.
Hindi siya normal.
Hindi normal.
Hindi daw lahat. Kasi yung habibi ni Rachel.
Sorry.
No?
Lagot!
Hindi naman na.
Sorry.
Huwag ka naman mula.
Sabay bawo.
Hindi kasi diba yung umusunado dito?
Oo. Hindi lahat. Diba? Okay na.
Okay ka na. Okay na. Rachel, okay na.
Kasi yan sa...
Sige, lipani na lang. Lipani.
Huwag na Angel.
Sunny, ganyan.
Oo. Ay, may pati pag isa. Magagalit si Chi.
Wala na lang amoy.
May monster sa lugar.
Again, if you didn't do the what they call this, the checking of the environment, immediately you jump in, administer first aid, magugulat ka, paparating na cobra.
Turo.
Ikaw na ang magiging pangalawang biktima ng snake na yon or ng animal na yon.
So check the environment first.
Exactly. That's the point of checking the
Environment.
yeah. If nakita mo may snake bite, anong gagawin mo? Eh, di hilain mo siya, i-relocate mo doon sa sa gitna ng dagat. Hanap pa ng ligtas na lugar. Doon mo i-conduct yung first.
Paano yung makanda kung sa gitna ng dagat?
Joke lang naman. Lahat naman na lang, oh.
Parang hindi ako nagising mo.
Oo, hindi na ako mag-joke.
Sabi ko nakagad sa gitna ng dagat.
Buhaya.
Parang pinatay mo rin. Ito mo minamatay ko. Sa gitna ng dagat.
Are we clear about this one? Threat determiner? Wala kayong tanong?
Yes.
Yes.
Okay.
So, ano ba ito?
Letter O, please read. Ma'am, please read.
Maroko.
Continued supply of oxygen to the patient.
Yeah. As a first aider, it is our main responsibility to ensure that there is continued supply of oxygen sa katawan niya. That's why we are performing CPR and rescue breath. Again, more than 3 minutes. If there is no oxygen flow in the body, the person will die. So this is very vital. Among all the responsibilities, ito yung mahalaga na dapat ginagawa ng first aider. So later on, you will learn how to obtain continued supply of oxygen. Clear?
Clear.
Okay. Ito, please read. What did ma'am?
Function to provide care up to their level of training.
I have mentioned before that as a lay person, you only have what? Basic knowledge
and skills.
and skills about first aid. Okay? Ngayon, after ng training mo, nalaman ng amo mo, ay kakatapos mo lang ng training ah. Meron na sugatan kang katrabaho, haba ng sugat dito. Haba. Sabi ng revisor mo, ng manager mo, tahiin mo nga yung sugat. Kakabay ko lang naman ng di ba? Ng training.
Kuha ka ng
Just finish your training, right? Please stitch the wound.
Sinulit ang
Surgery ka.
Gagawin mo ba yun?
No.
Exactly.
You're not alone.
It is out of your limitation. Hindi natin pinag-aralan dito yon. Okay? Out of scope yan. Sir, hindi ko kayang gawin yan. Pass tayo yan.
Nasa rules of limits ng ano.
Tama, di ba?
Even sa nursing assistant,
You're not
right?
allowed to
Do
perform
not perform
if it
your
is not your
duty.
responsibility.
If it's not
Responsibility.
hindi yung sakop ng iyong trabaho.
Yes.
Why? Gusto mo malaman. Why?
Ha?
Why?
Because hindi ko
Bakit?
license.
Bakit?
Sagot.
Pass.
Ano may tanong ko?
Oh, yun na.
Bakit? Hindi sinabi ko nga lang.
Yung nga, hindi yung nasa rules natin.
Bakit nga?
Yeah, yung rules na yan, bakit? Ba't kailangan
Diba nasa
natin gawin?
sabi nga nasa law yan, there's a rules made by authority ng
Okay.
natin na hindi natin may karapatan tayo pero may limit ang ano.
Oo.
Okay.
Excuse me.
Parang sinabi niyo ni Sarah.
And we don't have enough knowledge for that.
Very good.
Yeah, basically ano,
If you don't have knowledge to that activity or to that kind of treatment,
Don't perform.
do you think mabubuhay yung tao?
hindi
No.
po.
Exactly. Remember again the objective of this training? To administer first aid in a safe manner. Walang pinagkaiba yun sa nagbibida-bida. Kaya kong kainin yan. Okay, buksan mo nga yung YouTube dyan.
Sinulit at ka
Right? Wala kang kaalaman. Hindi ka doon naturuan.
Nasa dressmaking
Diba? Instead of helping that injured person, magiging worse pa at baka mamatay pa siya.
infection.
Do you agree?
Yes.
Ngayon, nakuha nyo na naintindihan?
Yes.
Okay. Kaya gusto ko mga Pilipino, pwedeng Tagalogin. Next.
All emergencies.
Call for Emergency Medical Services or EMS. Ito yung medical professional. Anong number ulit?
999.
999. Very good. Why is it very important to call 999? Bilang first aider, this is your responsibility. Why? Yeah, to the rescue, yes.
To address. Tama.
To
diba?
ensure.
To rescue ba? Ba't putol-putol? Ano ba ito? Dugtungan? Hanggang mabuo natin yung ano. Dugtungan.
Pagsagot ko no, to address, ikaw naman.
Tsaka to ensure eh. To address pa ensure.
Dapat ma-ensure ko na.
Again, as a first aider, we are only providing temporary treatment so that the person will survive while waiting for the medical professional. In short, hindi tayo yung gagamot sa pasyente. Okay? The medical professional will be the one who will give cure or treatment to that victim. Now, if you will not call 999, who will give the cure? Nan. Yung iba kasing first aider, ganun yung thinking. First aider, ligtas na to. Hindi na ako tatawag. Hindi ganun.
Mayabang naman.
So, we are only first aider, okay? We are not the medical professional.
Temporary.
Now, if you are only alone, no one can assist you in calling 999. I-dial mo yung 999, put your phone into speaker mode.
Yeah.
So, while performing the first aid, you are now conversing with the EMS. Kung wala kang phone, tawag ka ng tulong. Please help, call 999. Clear?
Yes.
Okay.
Art, help, videoan mo ko.
Then, assist medical help, of course. And this one, record all assessment, okay? Record all the informations you gathered about the incident. Pag sinabing assessment, later malalaman nyo, primary and secondary. Saan ba yung mga sugat niya, anong injury meron, ililista mo lahat yun. And kapag nakakausap mo yung pasyente, later i-discuss ko rin ano ba yung mga information na dapat mong alamin bilang marites. Okay? So, merong mga vital information na dapat hindi mawala. Okay? Then, encourage victim for recovery. So, please take note again, best of care.
Best. Kaya.
Ito po ang inyong trabaho bilang first aider. Maliwanag po tayo dito ha.
Yes, sir.
Baka mamaya hindi nakasecure yung access. Sabihin mo, ay hindi ko trabaho yan, first aider ako eh. Diba? Maliwanag ha. Maliwanag tayo ha, meron. Ay, ba't di ka tumawag ng 999? Ay, hindi ako tatawag ng 999. Ako na nga tumulong eh. Hindi ganun. Okay? Again, this is your roles and responsibilities as a first aider. Question? Wala? Walang nagumugulo sa mga isip? Ma'am, mukhang meron. Ano yan? Dali.
Pero mag-sing na po ako.
Ano na? Okay.
Follow-up question. Charot.
Time check, 11:40. Okay, I'll be giving you your first short break. Please be back by 11:55.
Kain na tayo.
Mag-stretch out.
Ihin muna tayo.
He was diagnosed with this kind of disease, we don't know. So if you did it without any hand gloves, it's your call. But again, it's really unsafe for you to do that. So me on my personal, what they call this, practice, okay, I'm bringing hand gloves. Meron akong isang pair ng gloves talaga lagi sa bag ko, naka ano yun, ziplock. But if we are dealing in your workplace, okay, may na-injury, the first thing that you need to ask is your what? First aid box or first aid kit. Inside the box, dapat merong gloves yon. If walang gloves, nako, pa-refillan nyo na. Okay? Clear? You need to wear hand gloves. Then, you need to use this one. This is what we call CPR face mask. You are going to use this when applying rescue breath. Rescue breath sa Pilipinas, mouth-to-mouth yung tawag, or AR, artificial resuscitation, artificial respiration. Okay? Here, rescue breath ang tawag natin. Paano ba ito nag-work? Papasok mo ito sa bibig ng victim, okay? Then dito ka mag-blow ng air. Meron siyang filter sa gitna para ma-prevent yung direct contact ng saliva. Okay? Sino bang may gusto? Oh.
Depende pag guwapo.
Again, hindi mo alam. Eh, kahit guwapo pa yun, hindi mo alam kung may sakit siya, di ba, na nakakahawa.
Okay lang kahit may sakit sa gilid.
Oh, boy, okay, mag-pray na lang kita.
CPR face mask, ha? Tandaan nyo to. Pwede nyo iikot. CPR.
CPR. Face.
Face mask.
Libre yan, sir.
Hindi. Dapat yung first aid kit nyo, meron yan. I-double check nyo sa company or sa workplace nyo.
Itry nga kita, Ate Dana. Speak up.
Ito naman,
Hindi ako makahinga.
this is what we call CPR face shield. Yeah, the function of CPR face mask and CPR face shield are the same. Ang pinagkaiba lang, ito, disposable. After a single use, dispose.
Yeah.
The other one, after using it, you can clean and sanitize, reuse. But same purpose. Ito yung air filter, dito ka magbubuga ng oxygen, na hangin. Mamaya, gagamitin nyo to pag nag-perform kayo.
Paano kung may gagamit ng CPR face mask na laman mo na meron pala siyang hepatitis? Paano po yan? Dispose na po yung
Dispose na siguro, oo.
Diba?
Hindi tayo magtiwala sa linis pa. Kahit pakuluan pa yan eh. Kahit pakuluan. Hindi, kaya yung yung mainam talagang gamitin, yung disposable.
Pronto kasi Morocco.
Disposable.
May punto, sir, na may punto.
Yeah.
May tanong kami, paano papasok yung hangin dito?
Float mo na.
Papasok yan.
Para siyang mask.
Tama.
May butas yan.
Alangan naman sino papasok pag walang butas.
Sige nga, try ka sa akin.
Sir, ibang butas na to, sir.
Mamaya, matatry naman natin mamaya.
Mamaya ito try.
Try mo nga, Art.
Mamaya ito try.
Tatry nyo daw.
Try mo daw.
Gagamitin nyo yan mamaya. Susubukan natin mamaya yan.
Yun. Yung pala yun.
Ang nga talaga yun.
Visible naman.
Ang dami naman makikita. Ba't yung butas ba yung hinahanap?
Wala kasi yung butas. Wala kasi yung butas.
Ano dito?
Yan ipapasok sa
Papasok
bumakan.
yan dito.
Tapos
Dito ka mabubuga. Later, malalaman nyo. Meron yan, meron.
Para siyang filter na.
Grabe ka naman.
Filter yan eh.
Air lang talaga yung makakadaan.
Halika mo ako, subukan ko sa'yo.
Kasi nga piniprevent natin yung direct contact.
Yeah.
Okay.
Thank you.
Again, clear?
Yeah, thank you, sir.
KFC na lang.
You need to wear hand gloves, you need to use face mask, you need to use CPR face shield and CPR face mask. Kung anong available. Okay? Yeah.
Wait lang.
Kung ito yung meron, gamitin
Yung
nyo to.
order, pag
Ito, yung reusable, ito,
pupunta tayo may
disposable.
discount.
Ano nga yung may pupunta na lang.
CPR face mask, CPR face
Finish
shield.
second.
Again, kailangan mag-gloves all the time. Okay? Simula sa una hanggang matapos yung first aid mo, dapat naka-gloves ka.
Cool na lang.
Clear?
Yes, sir.
Okay. Question. Please read.
I have to wear gloves at all times during
Bonus to ha. Ano it depends?
Yes or no?
Oh, yes or no?
Yes.
Ang sagot?
Yes.
Oh, very good. Obvious yan ha.
Uy, nag-no siya.
Hindi. Magsabi lang ako, it depends the situation.
Oh, it depends if no.
Sa gitna. What do you
Ito.
think should be?
Tanong ka niya. Ma'am, please read ma'am.
Who do you think should be your first priority in a mass casualty incident? Large crowded needing first aid. Pregnant. Okay.
Just your answer. Choose one ha.
Letter C.
Letter C ako. C.
Asthmatic attack.
Breathing, ah.
What do you think?
Yeah, yeah.
Kung walang breathing, walang
Airway.
airways, ano siya, mamamatay siya kung walang supply ng air.
Asthmatic.
Ang pregnant, pwede naman
Asthmatic.
punasan.
D.
Asthmatic.
Asthmatic attack. Hindi, asthmatic attack.
circulation kasi yung sa breathing.
Sige, maguguluhan na naman yung mga utak mo. Sana, choose one. Choose one only.
Airways and bleeding.
We are airways and breathing. Then,
Ay, hindi. Ang asthma, pwedeng ilagyan ng ano.
Kasi
Ng
bleeding
ano yung ano mo.
Circulation ng
Oo, wait, palitan mo. Lalagyan ng paper.
Ako
Wait,
letter C pa rin ako.
wait.
Answer?
A.
D.
A and C.
Choose one only one. A.
Natural lang na ang pedya na bleeding.
A.
Bakla.
D.
D.
Nabuntis din ako dati. Nag-bleeding ako kaya ako nakuha.
B.
R.
Okay. Ano pa?
A and C.
So, ang mga sagot natin, A, C, tsaka B, no?
Eh, baka letter D. Kasi ang
Okay.
bleeding, putol tapos bleeding siya. Hindi, kasi bleeding ang out of supply ng blood.
Again, amputated yung naputulan.
Naputulan, tapos may ano, lumabas ang
yes,
dugo,
D.
di ba?
Amputated.
Letter D ate, pagkupos ang dugo.
D.
di pala D.
Letter D ako na.
Letter C. Letter D.
Ay, hindi siya tatakbo pala, pwede siyang talian.
Pwede mo tanggalin gamit mo.
Pwede talian para sa D.
Ay, ano?
Ang unang sagot, letter C. Ang sumunod, letter B.
Letter D na.
Broken bone
Broken bone and leg.
Broken
Ah, sige na, answer reveal.
Pwede magkaroon ng hemorrhage sa loob.
Hemorrhage.
Internal bleeding yan ang pangyayari ganyan. Letter D yan or letter C.
Nagalit na si Ice.
Nainis na ako.
Let's go back again on prioritizing casualty. Anong sinabi kong mauna?
Letter C.
Person having issues on breathing, right?
Yes.
Hindi humihinga, nahihirapang huminga. Sa mga examples na to, sino yung nahihirapang huminga dito? Unahin natin.
I told you, asthmatic.
Kanta pala yung kanta.
Kanta.
Kasi sabi
Let's
breathing, di ba?
start back at one. Okay, airways.
Ngayon, natawag mo na yung may asthma. Sino susunod?
Letter D.
Pregnant with bleeding kasi circulation of blood.
Very good. Again, the keyword bleeding.
And
So, sino yung next priority? Sino yung pinakahuli?
Broken.
Other
Nabali
injury.
lang.
That's how we prioritize casualty. Lahat sila kailangan ng tulong, tama?
Yes.
Pero kapag yung may asthma, hindi mo agad inuna,
Patay.
eh ginagad to. Diba? Wala pa namang minuto, deads na to.
Objection.
Tama ba? Itong mga nagdurugo, mabubuhay pa to ng mga 1 oras, 2 oras. Eh lalo naman to, wala naman dugo, wala naman sugat eh.
Eh, kasi nga may hemorrhage.
Hemorrhage. Bila sa hemorrhage.
Kasi posible na magkaroon ng pagdurugo.
Yung hemorrhage.
Sa loob.
Those are complications. Complications.
Oo.
But again, ang pinag-uusapan, first aid.
Yes,
Okay?
yes.
Alam niyo na ngayon, ha?
Yes.
Okay, good.
Anong sagot? Very good.
Nagugulo, no? Pag may pumatanong, nagugulo yung mga utak na.
ABC daw.
Ano, isang ba?
Lagi ko ganito, back to ABC daw.
Here, meron tayong dalawang assessment. We have the primary and the secondary. When we say primary, it is the initial. The first, checking the first assessment that you are going to conduct to the injured person. Now, if magkakandak tayo ng primary assessment, ano ba yung mga dapat mong hinahanap sa pasyente mo? You need to search for life-threatening conditions. What are those? Unang-una, kung may malay ba o wala. If an injured person is unconscious pero humihinga, life-threatening pa din yun. Okay? If the person is not breathing or having difficulty breathing. Third, no circulation, no blood flow. These are the three life-threatening injuries or conditions that you need to search for when conducting primary assessment. Again, kaya siya life-threatening, kaya siya primary, kasi kailangan mo siya ma-discover agad. Once you discover it, immediately call 999. Kasi kailangan ng agarang paggamot dito. Clear. That's primary assessment. How about secondary assessment? Who wants to read the definition of it? Ma'am, go.
Succeed with life-threatening conditions and check on non-life-threatening conditions can take place. Interview may be conducted.
Very good. Again, secondary. If yung una mong assessment hindi humihinga, walang malay, naka-recover na ngayon yung pasyente. Humihinga na siya at may mali na siya. Now, you will search for non-life-threatening. These are other minor injuries na hindi naman niya ikakamatay. Kung wari, merong sugat sa siko, may sugat sa braso, namamaga yung tuhod, may swelling, you need to record. Remember, one of your responsibility, record all assessment. Then conduct interview. If the patient is conscious, you can ask him directly. If he is unresponsive, you can search for a witness na pwedeng magpaliwanag anong nangyari. Clear?
Yes.
So later, you will be able to find out what are the different informations that you need to gather. Mamaya, di-discuss natin yan. Time check, 5:14. First aider, they will come and help you. Pag sumisigaw ng help, sigaw. Help, 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 help! You need to shout, okay? Meron ng ambulance sa parating. What's next? How to open the airway. Your left hand, put it on his forehead. The right hand here, below the chin. Tilt it back like this. Again, do it gently, okay? If you overdo it, it may cause another injury. For example, excited ka, sir. May tunog. Diba? May tumunog, di na bumalik. Diba? Again, gently. After opening the airway, check the mouth for some obstruction or foreign object. Baka na-choke. Kaya pala walang malay, hindi natin alam. Again, sabi ko, i-check lang yung mouth ha. Huwag tanggalin. Okay? Check. After checking ng airway, anong sunod? Breathing. I-check mo kung humihinga ang victim. How to check if humihinga? Meron tatlong paraan.
Pulse.
Hindi. Humihinga nga eh. You
Your
need to listen, feel, and look. I will put my ear over his nose to check for some breathing sound. I will put my cheek over his mouth to feel air coming from his mouth. And meron tayong tatlong pamamaraan to check if merong blood flow. Again, if ang kulay ng palad niya, kulay gray na siya, black, it means there's no blood flow. If there is no blood flow, mag-a-apply na tayo ng CPR. How to do CPR? Ito yung video.
Because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as is ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?"
Okay,
If there is no response, you need to. S, shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, you need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest, and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site, called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC, and if you have it, D. That's B for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation.
Clear? Okay, I will demonstrate to you how to perform the CPR. Then after nun, babalik ako from the start. I-demonstrate ko ang doctor's ABCD along with the CPR and rescue breath. Okay? Again, for the CPR, the body positioning is very important. It's very crucial, okay? You need to kneel beside the victim. The victim's body should be parallel to you, okay? The heel of your palm put here, at the center of his chest. Here. Then interlock the other finger, okay? I-check nyo yung kamay ko ha. Yung dapat siya nakalapat. Na dibdib. Now, look at my arms. Your arms should be straight. If you are going to push down later, do not bend your arms. It should be straight. Check my body. I'm leaning forward, so my body weight will help me to push down. Clear? How many seconds again? How many compressions? 30 compressions, right? How many rescue breath? 2. Okay. I will show you how to perform the CPR. Okay? That's how we do CPR. Now, back from the start. Ulitin natin. From D hanggang dito. Okay? I will demonstrate it to you, then after nun, kayo naman. But in your case, okay, you don't need to explain it. You will assume that you are really in a real life situation wherein there's an injured person. How will you react? Following? Okay, good. Now, let's proceed. For letter D, we will assume that we check already the accident site. Now, I will begin with letter R. Okay? Sir, good afternoon. Sir, are you okay? Sir, wake up. Sir, are you alright? Sir, wake up. Sir, are you alright? Sir, help! Someone is injured. He is not responding. Ma'am, please call 999. Thank you. Open the airway. Check the mouth for obstruction. After that, check the breathing. How many seconds?
10 seconds.
Very good. There's no breathing, there's no response. I will check for the circulation. The color of the lips is gray. It means there's no circulation. Now I will perform CPR. Dirty compressions. When giving rescue breath, it's very important that the airway is open, okay? And you need to pinch the nose. By pinching the nose, we are preventing the air from coming out. By opening the airway, we can ensure that the oxygen or the air that we are about to give will go directly to his lungs. Okay? Clear? How many rescue breath? 2. Now I will perform. 1. Second one. We have issues on mannequin, but in real life, the chest will inflate. Then after that, wait for the chest to exhale or go down before you give the second breath. If the chest is moving, it means your rescue breath is successful. Then after that, remove the face shield, check for breathing again. 10 seconds. And check for circulation. If wala pa din, proceed ulit sa CPR ulit.
So how many circle po po?
Maximum time for an operator to perform is 2 minutes.
2 minutes.
Maximum. Or until the ambulance arrives. If nandiyan na sila, wala pa 2 minutes, much better. Later on, malalaman nyo, sir, paano pag 2 minutes na yung gagawin? Wala pang ambulance. Dito muna tayo mag-focus. Doctors, ABC. Are you ready? Una ka na.
Nagulat.
Lakad ka. I memorize nyo, doctors, ABCD. Nalaktawan nyo yung D, R tayo mag-start.
Sir, are you okay? Are you alright?
Sir,
are you okay? Are you alright?
Very good.
Help, call 999.
Very
Tama, sir?
Yung
Tama ba?
uno-uno.
Yung oo.
Forehead at saka yung skin.
Okay, then check them out for obstruction. Check
Ay,
mo.
check.
Bakit pag nandyan ako, nakakamali ako? Pero
Kaya, di ba?
Pero pag ano yung
Saka titingin, diba tatlo yun? Listen,
nakaupo ka lang
feel, tsaka look. Saka titingin.
sa breathe.
Tingnan mo yung chest niya kung gumagalaw. Oo. Dito ka dapat nakatingin.
Look. And then listen.
Yung tenga mo sa ilong. Yung pisngi mo sa...
Baliktad, be. Baliktad. Yan.
Uyan mo na to. Interlock mo to. Lapat mo ha. Lapat ang kamay.
Sa may gitna ng chest.
Straight mo to. Lean forward. Push down. Harder. Sige. Aralin mo muna kung paano yung push.
Dapat hindi nagaganon girl lahat. Hindi straight.
Push mo muna, push. Sige. Sige, push mo muna. Sige pa, harder pa. Sige, pakiramdaman mo kung paano yung push. Okay. Okay, gawin natin ng meron ng speed.
Ay, sorry.
Go.
Ano na? Magkano, be?
Kinis na.
Magkakanin sa
Ay, sa'yo lang.
Harder. Bilisan mo konti.
Mami, ang withdraw ko yung pero okay.
Stop. Again, dapat nakalapat
Pero
yung kamay. Okay, go. Harder. Faster. Bilisan pa konti.
Buhay na siya.
Then, rescue breath. Open the airway.
Parang kailangan yung CPR dito.
Baka mamaya siya na yung CPR.
Open the airway, ha? Airway open. Open, open, open.
Open. Angat mo bakla.
Angat pa, angat pa. Sige pa. Sige pa, open.
Kinabahan.
Yan, kailangan open ang airway sa rescue breath, okay?
Ipisilin
Pinch
yung
lang.
ilong.
Takpan yung ilong. 1, 2. Okay, very good.
Sir, are you okay? Are you alright? Sir, are you okay? Are you alright? Help! Anyone, please call 911.
Call ko po na yun. Video niya na si Inay. Ay, nakakita. Send mo nga sa akin yung video. Sakit pala siya sa ganito. Now na. Hindi
Two
po ito
rescue
yung...
breaths.
Mamaya, loading siya.
Loading. Ayan.
1.
Lahat na nakabigay?
Okay, very good. Next.
Sir. Cellphone. Ayun. Sir, are you please call 999?
Okay. Airway, open, airway.
Nakakatakot.
Check the mouth.
Kala mo.
Okay. Breathing.
Wala na, bulag.
Alakat eh.
Circulation, very good.
No breathing, no response, no circulation.
Now perform CPR. Straight your arms, lean forward your body. Are you comfortable? Medyo tikom na konti yung legs. Okay.
Bakit ba? Siyempre hindi ko na kami kakakomfortable yun.
Puro kayo mga bully eh.
Very good. Then 2 rescue breaths. Oh,
Ano gagawin mo?
rescue breaths muna. Okay.
Mubul mo kayo.
Nandun yung asawa mo sa labas.
1. Okay, very good. Then after that, check the breathing again.
Hindi ko yung tingin.
Okay, 10 seconds yung breathing. Okay. Ayun yung procedure natin, ha? After rescue breath, check ulit yung...
Sir, are you okay? Are you alright?
Wala. Lalaki siya ngayon.
Hinga lang, hinga.
Are you okay? Are you alright?
Gwapo mo dyan, Vince.
Sir, are you okay? Are you alright?
Yung bones.
Okay.
Ang iyak. Iyak siya.
Ano ba next din?
Help.
Help! Call 999.
Very good. Very good.
Ano pa ba
Check
yun?
the mouth.
Ano pa po yun?
Very good.
Nakaka-mental, di ba?
Breathing.
Okay. No breathing.
Tayo na.
Tayo mo.
Very good.
Nanguhula.
How many seconds?
10 seconds.
Advance, no?
Ito lang.
No breathing dito.
Short
After
kasi
breathing, what's
naputol
next?
sa kanya, then ako na yung nag-continue sa kanya.
Circulation. Yung dito po.
Okay, very
Kasi hindi
good.
naman tumawag.
No breathing, no response.
No circulation.
Very good. Now perform CPR. Lapit konti.
Oo, yung grade mo.
Di ko mga legs ng konti.
Bubukas
Lean
na.
forward. Okay. Lean forward pa.
Lean forward.
Yan. Komportable na?
Opo.
Baba mo yung dali mo, babe.
Alam mo yung
Yes,
parang
go.
kung meron akong basic solas.
Very good.
Pero ako,
Diyan kayo siya magaling.
ilang buwan na yun. Ay, isang buwan.
Okay, no response. Tapos, ito na.
Tapos ako nung next stage yun.
You may now
Pinch.
Tapos nung ako nung 6 stage. Dati 89
Pinch,
ako,
pinch na
ngayon
nose.
ano na lang ako.
Okay, very good.
Nanginginig. Pag busog ako,
One.
syempre pag kumain ako, like,
Okay, very good. Yes, check ulit ang breathing. 10 seconds.
pag gutom na ako ulit, pag gutom na ako sa
Ang dami na sinig-CPR. Kaya okay, one.
Lead forward pa, lead forward.
Pag-actual yun.
Okay, go.
Kasi lalo na.
Harder.
Kasi sa mata eh.
Okay, very good. Continue that.
6 kilos na lang. Bakit? Ang ginawa mo? Ako walang diet. Nag-workout ako. Bahala na dyan, kain ng kain. Kailangan ko kasi. Nag-gym ako. Pabalik ko muna. Kailan balik ako?
Ako nga, kailangan ko.
Ano na?
Kasi nga,
Sana 3 days lang kami.
One.
Pag bumalik ka ng London, tapos natapat ng bayaran mo doon.
Okay, very good. Great job.
Ayun na.
Next.
Ngayon 30. So, yung...
Sa lahat, ikaw lang yung nasabihin na sir na great job.
Which we call CPR. What is the meaning again of CPR? Cardiopulmonary resuscitation. How many compressions? 30 compressions, then 2 rescue breaths. Question, sir, what if I don't have face shield or I don't have face mask? Can I perform rescue breath?
yes.
Can you perform it?
Yes, if you don't have.
Again, if you don't have this device, CPR face shield, CPR face mask, you can skip the rescue breath. Just continue doing the CPR. It is not mandatory to perform the rescue breath. Another scenario, you have the device but you are not confident to do it, you may not do it. Skip it, perform CPR only. Clear?
Ay, so, may nakita po akong tissue ang ginagamit po nila.
Tissue, clothing, again, they are not advisable. Remember, we are dealing with infections, viruses. The CPR face shield and the CPR face mask, they are created for this purpose. Merong air filter to prevent the saliva from passing through. If you are going to use cloth, tissue, hindi naman yung ginawa para dito. So what will happen? Exactly, saliva will be transferred. Lalo sa tela, makakalusot yun. Para mo lang din siyang hinalikan nun. Nilagyan mo ng tela.
May oo.
For the tissue naman, hindi siya, unlike ito kasi, may mga tiny holes siya na makakapasok yung air. Sa tissue kasi close yun.
Kasi may nakita ako. Ano rin siya, baby din siya, parang nahirapan bagong panganak. Nakita ko tissue yung ginagamit ng nurse or ng ano po.
Not allowed, not advised.
Kasi nahirapan po yata yung baby na huminga. So,
Again,
she's using tissue.
CPR face shield, CPR face mask lang ang pwedeng gamitin. If you don't have it, do not do it. Simple as that. Huwag kayong gagamit ng kung ano-ano dyan, ha? Hindi ko tinuro yun. Ako. Clear? Okay. Again, when we are pushing or when we are doing the compression, when you say heart, the chest should go down 5 to 6 centimeters or at least 2 inches. Lulubog yung dibdib. That's what we call heart. Ganun siya ka-heart. Okay? Now, in 1 minute, you are expected to produce 100 to 120 compressions. 1 minute. In 1 minute, okay? So 100 to 120, ayun yung gauge natin. Para ma-measure mo kung nasa tamang speed ka ba. Now, the maximum time is 2 minutes, right? So 1 minute, 100 to 120. Times 2 mo yun.
240.
You are expected to perform 200 to 240 compressions. Maximum. What you did is only 30 compressions, but some of you were, I'm not sure, It's real, right? It's true. If you are not used on doing natin, fingers. Kung kanina, 2 kamay, ito fingers na tayo. Same. At the center. 30 compressions. 1, 2, the 30. Now, the difference between the infant, the child, and the adult in terms of rescue breath, isipin nyo, ito yung bibig ko. Kapag mag-rescue breath ka ng sanggol, both mouth and nose, you should cover them. And you don't need to use CPR fishing for this one. Clear? Now, for child, more than 1 year old, 2 years old, ganyan. Child na consider yan. It depends on the build of his body. We have 8-year-old, 7-year-old, 9-year-old na malalaki ang pangangalawan. If that's the case, you can use both hands. Okay? But if the child is too thin, ayan, you can only use one hand. Same compressions, okay? Then 30. And after that, 2 rescue breaths. For adult and child, rescue breaths are the same. Pinch the nose, blah blah. Clear? Infant, both. Over the nose at mouth. That's the only difference. Clear? Question? Okay. Here. We have mentioned that 2 minutes, yeah.
For the infant that going down now.
Yes, for the rescue breaths. Same lang din, 1, 2. 2 rescue breaths. All of them are the same, okay? 2 rescue breaths, 30 compressions. Sa breathing 10 seconds, yung ano.
Every child, infant, child, tsaka adult,
Same.
yes. Tapos, 30 compression, same lang. Pero ang pag ano lang, pag pump, different lang. Palm to finger, then, correct?
Kasi that's like 1 second for the infant.
Yun ang ibubulo yung buko.
Competent. We are not allowed like, this one, big body. Come, brother. I will teach you. It's not allowed. If you are asking to help, if you are asking help from someone, you need to confirm that he or she is competent. He should have the training as well. Just like what we are doing now. Clear?
Yes.
Again, back to my question. No one will swap over. You are already tired. You've been doing already 250 compressions. Ganito ka naman, sir. Di ba?
Next person.
You are tired. You are exhausted. Anong gagawin mo? Stop.
Rest.
Rest. Kapag nag-rest ka, mag-stop ka. Tama? Ano pa?
Take a deep breath.
Ask for help.
Ayan, nagugulo na naman yung mga nila. Dumadami na naman yung mga sagot niya. Tapos, okay, again.
Di ba, ask for help.
Yeah, maximum 2 minutes. If no one will swap over, etong gagawin mo. Stop performing CPR. What are the situations or reasons when to stop CPR? Ito yung mga sumusunod na kadahilanan. First, if the signs of circulation has been restored, which means the injured person is already breathing, okay, and he is conscious again, you will stop performing CPR. Clear? Second, if you turn over the injured person to the medical professional, the ambulance arrive already, you hand it over to them, definitely you will stop performing CPR. Third, please read all of you. Or stop performing CPR. Now, sir, what if, ito, nangyari sa grupo namin, marami kaming first aider. There are many of you who can swap. Now, you don't need to maximize the 2 minutes. After a minute, you can ask someone to swap over. Every 1 minute. So that we can preserve the energy. Clear?
Sa school.
Get the idea?
Yes.
Okay, next. Physicians or the EMS assumes death. We are not the one who will declare the death of that injured person. It should be the EMS, the medical professional. If they told you, sir, wala na siyang buhay, definitely you will stop performing CPR. Clear? Clear. How about this one? Sir, how come? During the doctor's ABCD, letter D is the first thing, right? I have checked it. Why suddenly I will stop because it's unsafe? Why? What you did during the doctor's ABCD is only initial. There's no guarantee that the same condition, the same situation will last forever or until the end of the treatment. Right? Who knows, while performing the CPR, suddenly there's an explosion, or there's fire, or there's a chemical leak, gas leak. Are you going to be a hero? Sunog lang yan, ako lang yan, tuloy ko to. Diba? Huwag tayong pakabayani. Diyan na yung apoy, sunog na yung room, stop, alis na. Hindi pwede, hindi pa siya humihinga eh, tuloy ko pa to. Both of you will end dying. Exactly. Clear?
Clear.
So these are the reasons when to stop CPR. Maliwanag?
Yes.
Balik tayo dito.
Hindi nakalakpaw na si Kira. Si Kira sa yes.
Ano na?
Okay? Quick test. This is done already. Okay, formally test. Remember, you need to gather informations, right? What are the informations that you need to ask or you need to gather? Here are the following. Signs and symptoms. Allergies. Yung victim ba may allergy? Second, yeah, he or she is taking medication, ask him. Ask her. Past medical history. Ano ba yung mga sakit niya before? Diabetic ba siya? High blood ba siya? I-check mo yung past medical record niya. And this one. So, electrocution. Diba? Clear?
Yes.
Yan yung tawag dito demonstration or illustration kapag naggumagamit tayo ng AED or yung defibrillator mismo sa hospital. Yung yung gano, malaki ginaganon. Tapos aangat yung katawan. Clear? Okay. Saan pa ba yung iba ko dito? Wala na. Question about AED. Going to squeeze out the air, going to the airway. So what will happen? The air will push the obstruction. Guess yung idea?
Yes.
Have you tried drinking soda and you put it inside the bag? If you're going to pinch or squeeze the lower part, what will happen? It will come out right through the straw. Same thinking, same logic. So what to do? Is squeeze the stomach 5 times.
Subscribe. Thank you for watching.